Hey everyone, welcome back to my YouTube channel, Health Hub. Please subscribe to the channel for more insightful health-related contents. Antibiotics are a cornerstone of modern medicine. They've saved countless lives and revolutionized healthcare, but a silent pandemic threatens this progress. It's called antibiotic resistance. Antibiotic resistance doesn't make headlines like new viruses or diseases, but understanding this threat is crucial for all of us. Why? Because it affects everyone, regardless of age, location, or health status. This isn't just a problem for doctors and scientists. It's a global challenge that demands a global response. We all have a role to play in preserving the power of antibiotics for future generations. This essay will explore antibiotic resistance in detail, will uncover its causes, consequences, and potential solutions. Simply put, antibiotic resistance occurs when bacteria evolve to survive the drugs designed to kill them. It's like a microscopic arms race. We develop antibiotics to fight bacteria, but bacteria, being incredibly adaptable, find ways to outsmart these drugs. When bacteria become resistant, antibiotics lose their effectiveness. This means infections become harder and sometimes impossible to treat. Imagine a world where a simple cut could turn deadly, or where routine surgeries become extremely risky. That's the potential reality we face if antibiotic resistance continues to rise. The rise of antibiotic resistance is a complex issue driven by several factors. This growing problem poses a significant threat to global health, making it crucial to understand the underlying causes. One major culprit is the overuse and misuse of antibiotics. These powerful drugs are often seen as a quick fix, leading to their overprescription. Antibiotics are often prescribed unnecessarily, for example, for viral infections like colds and flu, which they can't treat. This misuse not only fails to cure the illness, but also contributes to the development of resistant bacteria. Even when antibiotics are necessary, not completing the full course prescribed can allow resistant bacteria to thrive. Patients may feel better and stop taking their medication early, but this incomplete treatment can leave behind the strongest, most resistant bacteria. Another contributing factor is the use of antibiotics in agriculture. Farmers often use these drugs to promote growth and prevent infections in livestock, a practice that is widespread in many parts of the world. While this can lead to healthier animals and higher yields, it also creates an environment where resistant bacteria can develop and thrive. These bacteria can then spread to humans through the food supply and other means. But this practice can lead to the development and spread of resistant bacteria, which can then spread to humans. The bacteria that survive the antibiotic treatment in animals can transfer to humans, making infections harder to treat. Finally, the lack of new antibiotic development is a growing concern. As bacteria evolve and become resistant to existing drugs, the need for new antibiotics becomes more urgent. Developing new antibiotics is costly and time-consuming, and pharmaceutical companies have little financial incentive to invest in this area. The process involves extensive research, clinical trials, and regulatory approvals, all of which require significant resources. If you're still following us, please click the subscribe button, share, like, and comment for more insightful health contents. This lack of innovation means we are running out of weapons in the fight against resistant bacteria. Without new antibiotics, we risk returning to a time when simple infections could once again become deadly. Antibiotic resistance poses a significant threat to global health. As bacteria become resistant to multiple antibiotics, our treatment options dwindle. This leads to longer illnesses, increased hospital stays, and a higher risk of death from infections. The economic burden of antibiotic resistance is also substantial. Resistant infections require more expensive treatments and result in lost productivity due to prolonged illness. The World Bank estimates that antibiotic resistance could cost the global economy trillions of dollars by 2050. Beyond the immediate health and economic consequences, antibiotic resistance threatens to undermine decades of medical progress. Surgeries, organ transplants, and cancer treatments all rely on effective antibiotics to prevent infections. Without them, these life-saving procedures would become far riskier. Section 5. Meet the superbugs antibiotic-resistant bacteria. There are numerous antibiotic-resistant bacteria, each posing unique challenges. Methicillin-resistant Staphylococcus aureus, or MRSA, is a prime example. MRSA commonly causes skin infections but can also lead to pneumonia, bloodstream infections, and surgical site infections. Carbapenem-resistant Enterobacteria CE or CRE are another group of highly resistant bacteria. They are resistant to most available antibiotics, making infections extremely difficult to treat. These are just two examples of the many antibiotic-resistant bacteria threatening public health. The rise of these superbugs highlights the urgency of addressing antibiotic resistance. Section 6. Fighting back: treatment options for resistant infections. The good news is that we are not defenseless against antibiotic-resistant infections. Doctors can often use alternative antibiotics or combinations of antibiotics to treat resistant bacteria. However, these options are often less effective, more toxic, and more expensive than first-line antibiotics. In some cases, there are no effective antibiotics available, leaving patients with few treatment options. Beyond treating individual patients, hospitals and healthcare facilities play a crucial role in controlling the spread of resistant bacteria. Infection control measures such as hand hygiene, isolation of infected patients, and prudent antibiotic use are essential for preventing outbreaks. Section 7. Prevention is key: our role in combating resistance. While developing new antibiotics is crucial, preventing antibiotic resistance in the first place is equally important. This involves a multifaceted approach that includes both scientific innovation and public awareness. This is where we all have a role to play. Every individual, from healthcare professionals to patients, has a part in this fight. One of the most effective ways to prevent resistance is to use antibiotics responsibly. This means understanding when antibiotics are necessary and when they are not. This means taking antibiotics only when prescribed by a doctor and ensuring that we follow the prescribed dosage and schedule. Completing the full course of treatment is essential, even if we start feeling better before the medication is finished. Additionally, not sharing antibiotics with others is crucial. Sharing medication can lead to misuse and contribute to resistance. We can also prevent infections and therefore the need for antibiotics by practicing good hygiene. Washing our hands frequently and thoroughly is a simple yet effective measure. Covering our coughs and sneezes with a tissue or our elbow can prevent the spread of germs to others. And staying home when sick can all help to stop the spread of germs. This not only protects others but also helps us recover more quickly. Furthermore, staying up to date on vaccinations is crucial. Vaccines are one of the most effective tools we have to prevent infections. Vaccines protect us from infections, reducing the likelihood of needing antibiotics in the first place. By reducing the need for antibiotics, we can slow the development of resistance. Together, through responsible antibiotic use, good hygiene practices, and staying current with vaccinations, we can combat antibiotic resistance and protect public health for future generations. Section 8. A global threat, a global response. Combating antibiotic resistance is not a battle any one country can win alone. It requires a coordinated global effort. International organizations like the World Health Organization and the United Nations are leading the charge in raising awareness and coordinating action. Governments worldwide are implementing policies to promote antibiotic stewardship and reduce inappropriate antibiotic use. Researchers are working tirelessly to develop new antibiotics, diagnostic tests, and alternative treatments for bacterial infections. While progress is being made, much work remains to be done. Increased funding for research, strengthened surveillance systems, and improved public awareness are all essential for tackling this global health threat. Section 9. A call to action: securing a future with effective antibiotics. Antibiotic resistance is one of the most pressing public health challenges of our time. It is a silent yet rapidly growing threat that affects everyone, regardless of age, gender, or location. It threatens to undo decades of medical progress and has the potential to plunge us into a post-antibiotic era where simple infections could once again become deadly. Imagine a world where routine surgeries, minor injuries, and common illnesses could lead to severe complications or even death. The good news is that we can still avert this crisis. There is hope, and it lies in our collective ability to act now. By understanding the causes of antibiotic resistance and taking steps to prevent its spread, we can preserve the power of these life-saving drugs for future generations. This involves not only proper usage of antibiotics, but also investing in research for new treatments and alternatives. This requires a collective effort from individuals, healthcare providers, policymakers, and researchers worldwide. Everyone has a role to play, from practicing good hygiene to supporting policies that promote responsible antibiotic use. We must all do our part to ensure that antibiotics remain effective tools in the fight against infectious diseases. This means adhering to prescribed treatments, avoiding unnecessary antibiotic use, and supporting global initiatives aimed at combating resistance. The future of healthcare, and indeed the future of humanity, depends on it. Together we can secure a healthier, safer world for ourselves and for generations to come.